Okay, so if you fix movement, you can fix pain. And what that means is, especially in terms of sciatica or lower back pain, if something like walking, sitting, or standing increases your pain as well as any other movement, it's likely a movement problem. A movement problem is a lot better than something that's not a movement problem. If your pain is throughout the day unchanging, probably not a movement problem. Most movement problems are caused by compensation. So if we look at this uh, human body over here, basically there's areas of the body that are supposed to be stable and there are areas of the body that are supposed to be mobile, areas that are supposed to move. And especially with sciatica and lower back pain, boom and boom, right here and here are the two areas that are most likely affected. In the lower back is supposed to be stable. If this is not stable, then that can cause problems. The hip right here, this is supposed to be mobile. It's supposed to be able to move freely. If it's not, that can cause problems. Most oftentimes, pain is caused by compensation. So if one area, let's say the lower back, is not working properly, it's not stable enough, what is that going to cause? Well, that's going to cause your hip to get tighter. And if your hip gets tighter, that can cause sciatica. And vice versa. If your hip is too tight, causing your back to be too loose, that can cause sciatica. So the body's very complex and everything works together. Basically, every other joint, which is pretty cool, is mobile or stable. So you have stable at the ankle, at the foot, mobile at the ankle. Then you go up to the knee and you're supposed to be stable. Then you go up to the hip, you're supposed to be mobile. You go up to the back, you're supposed to be stable. And then the mid back, you're supposed to be mobile, and so on and so forth. So every other joint basically is either mobile or stable. So you can imagine that compensation would end up causing pain. The body's going to find a way to move no matter what, even to the point of self-destruction. So even if it's going to move with, having to tighten up this hip more in order to move, still going to, even if it causes you pain. And the joints do many movements, especially in the hip and the lower back. So let's show you a couple of those things. A little video here. So basically, we have all of these motions. So number one for the hip, that's hip flexion. You can do it both ways there. Hip extension with the hip going back. Hip abduction out to the side. Hip adduction, other way. And then we have hip internal and external rotation. So there are 6 movements in the hip. If one of those movements isn't working properly, things can go wrong. Now let's look at the back. So we have flexion, here's extension, bending back. Now we have side bending, bending to either side. Rotation, either way. So again, that's 6 movements there. So if any of those movements aren't working, that can cause a problem. Now let's look at this as a deadlift, and this puppy is very happy to be picked up. But if we pause it here, this is when you go to pick up an object. You have movement at the ankle, you have movement at the knee, movement at the hip, movement at the back. If any of those are not working, that can cause compensation, which can cause pain, particularly the sciatica pain. Same thing goes for a squat. She's just going a little deeper here. So all of these joints are moving. If one part of this whole body is not working, that can cause pain. Let's also take a look here. So here we have human body. If we take away some of the muscle and put the nerves back in here. So sciatica pain. Here is the sciatic nerve, the biggest nerve in the body. So let's just appreciate the size of that nerve. Bigger than any nerve by a lot. If this nerve gets pinched here, the nerves can even get pinched up here. It can cause that shooting pain that you feel in your butt and all the way down, because as you can see, it goes all the way down the leg. Now, what causes that to get pinched? Well, we have muscles in here. I'm sure you've heard of the piriformis. This is one of the main culprits. So if this muscle is tight and pressing on the nerve, that can cause it to shoot down. Now, how does this muscle get tight? Well, this muscle can get tight if one of the motions in the hip is not working properly, one of the motions in the back is not working properly, or maybe the hips are just out of alignment. Maybe they're a little bit twisted either way. and that can cause the muscle to get tight. Muscles will normally stay in their right spot. They stay in the right spot for a long, long time when you're young. When you get older, you can get some sort of weakness sometimes or tightness, things like this, and that's why you end up getting the pain. So again, that's number one spot it can come from. Second spot it can come from is your lower back. So the nerves come out of these little holes here, little holes in the spine. If these holes end up getting smaller, that can cause the nerve to get pinched, and the nerves go all the way down the leg. So there's multiple spots that the nerve can be pinched for sciatica pain, and lower back pain as well. So how do we fix this? We just need to fix what isn't working. So there's a few things. Number one, tight muscles. So muscles can be tight. Number two, stiff bones. The bones can be too tight and stiff and not move enough in certain areas. Number three, weak muscles. So certain muscles might be weak, and these might not even be the muscles that you would think of, but they might be the deeper muscles, the postural muscles, the muscles that hold you in good posture and hold your bones in the right place so nothing ends up getting pinched. And number four, poor movement patterns. So a lot of things that are chronic, a lot of pain that's chronic ends up being caused by the things that we're doing all day long. So this could be something like standing improperly, walking improperly, maybe exercising improperly. Over time, this adds up and things can end up getting out of whack and end up pinching certain nerves, causing pain. So I hope you learned a lot. If you fix movement, you can fix pain.